Hello and welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and I'm on a mission to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be talking about neurology, we'll talk about MS, health and wellness, and we'll even throw a little bit of music and music therapy in there as well. Thank you all so much for joining us, and stay tuned for the next episode. All right. Hello, friends. It's Dr. Mitzi, your board certified neurologist and MS specialist. And I am so very excited to be here with you all to talk about MS and the immune system. And I'm so excited about our guest that we have on tonight, Dr. Imatola. So if you just want to log in and tell us where you are dialing in from, that would be amazing. All right. Awesome. Okay, and first we'd like to start off by thanking our sponsor, Janssen, and you can learn more about them by going to moretoms.com. All right, so today we are going to talk about the immune system. We're going to talk about some of those myths, some of those things that everyone has questions about. And I'm very excited to talk about it because there are a lot of misconceptions about the immune system, right? Whenever we talk about the immune system, we're usually saying your immune system is low and we need to boost it, but with MS, your immune system is doing too much or doing the most, as I like to say. So we're going to bust all of those myths. We're going to talk about those misconceptions. And at the end, if we have time, we're going to talk a little bit about stem cell transplant, because I think it's very important to talk about that when we're talking about the effects of MS on the immune system. As I said, welcome to Brain Chat. Log in. Let us know where you are dialing in from. We're very excited to have you all tonight. And while you are putting in the chat where you're viewing from, I am going to introduce our phenomenal guest tonight. All right, so give me just a second. I know I say I'm excited every week, but this week I'm really excited. Okay, so Dr. Imatola is the Vice Chair of Neurology Research, Director of the MS Center, and Chief of Division of Multiple Sclerosis and Neuroimmunology, as well as an Associate Professor of Neurology, Genetics, and Neuroscience at UConn Health. He is a physician scientist, neuroimmunologist, who has been interested in progressive multiple sclerosis and stem cells for the last 20 years. He trained in medicine and neurology in Columbia, then migrated to Boston, where he trained in neuroimmunology and stem cell biology at the Center for Neurologic Diseases and the Partner MS Center, Brigham and Women's Hospital at Harvard Medical School. He became faculty of the Harvard Stem Cell Institute and the Department of Neurology, and then decided to pursue additional training in neurology at Temple and Jefferson Hospital in Philadelphia. He has more than 165 papers, abstracts, and book chapters, many accolades and awards, including the 2020 Inspiration Award by the MS Society. And he has mentored and trained many residents, medical students, and undergraduates. And he also has leadership roles at the national level in the MS Society, the National MS Society, including the National Medical Advisory Board. And I'm so excited to have worked with him on several projects. And I'm also representing my MS Society board member hat here. Welcome, Dr. Imatola. Welcome to Brain Chat.
Oh, thank you very much for having me. I love the music of introduction. I was very excited. That's very nice. I love.
Thank you. All right. So we're so excited about this topic tonight because we really, this season, have been trying to be a little bit more scientific. So we talked about some of the science last season, but I really want to delve into things like helping people understand the immune system, because here at Brain Chat, we really want to empower people with that knowledge to understand their disease to the best of their condition, and then take that information back to their healthcare team so that they can make the best decisions possible to treat their MS. But before we get into the immune system, just tell us a little bit about how you got interested in the field of MS and especially in the field of stem cell research.
Yes, thank you very much. I mean, I was born in Colombia, the country in South America, and when I was a med student, I had one patient that unfortunately died, and
Mhm.
died for something that is rare in our countries in South America, MS. And I was very intrigued about that, and I decided to study a little bit more and research a little bit more, and then led to another thing, led to the interest in coming to the States, and then that led to the interest in doing neuroimmunology. And when I came to Harvard, the first approach and the first thing I did was actually train in stem cell. So I married the two things. I had a great mentor in Harvard, and then we married this interest in neuroimmunology and stem cells, and I that's has persisted since then. Yeah, so it's more was most the patient interest in trying to solve a patient's kind of mystery, and but yeah, and I'm here after
Awesome.
20 something years.
Awesome. Well, we are going to dig into that expertise and pick that brain before we get off the show today. But before we talk specifically about stem cells, let's just kind of take a broader view and talk about the immune system, right? So, whenever I explain to people what MS is, I give my very simple introduction. MS is an autoimmune disease, meaning the immune system, the part of the body that normally attacks viruses and bacteria, gets confused and attacks a good part of the body. But let's talk a little bit in more detail about what is the immune system and what does it do in normal circumstances?
Yeah, it's a great question, and thank you for that. So the immune system is just a cellular system, meaning that we have cells, and the cells have a role to play. And in this case, is recognize whether or not there are invading bacteria, viruses, other pathogens, and defend us from that. In addition, if we have tumors forming in our body, these immune cells will be activated and get rid of those tumors. So the immune system is a huge army that has multiple kind of sub-specialization, if you will. Imagine the Navy and the Army. You have captains, you have lieutenants, and you have people that are gunning, or people that are cleaning. So that's kind of it's a very huge kind of society that we have inside our bodies, patrolling the body every single moment. And we are alive because we have a immune system. Now, when we talk about patients with MS, you're right. Many patients say, well, my immune system is low. It's not really accurate, because, as I mentioned, there are multiple different people or roles that the immune system has. Then it might be that you have one area that is decreased, but the rest other areas are going to be okay. And that's what we we separate the immune system into branches, right? the
Mhm.
the the cells that produce antibodies, the cells that are actually recognizing other cells or proteins, and these together will make what we call the immune system.
Yeah. Yeah. So such important information, So there's so many different parts. And my explanation is very, very simplistic, but there are many, many different parts and branches. And I love that analogy of like the Army and the Navy and the different, because there's so many different cells. Whenever we go to a conference, and they put up a slide about the immune system. It has like a million different cells on it. So it can be a very complicated system. So going into a little bit more detail about MS, right? When we think about MS, we know that there is an abnormality of the immune system, that the immune system is fighting those bacteria and viruses and preventing tumors, but it's also doing something else that it's not supposed to do. It's attacking the myelin or the coating of the nerves. Let's talk a little bit more about what happens to the immune system with
Yeah.
MS.
So it's a very interesting question, and very, very simple. Actually, it's a very simple answer. We have variations in the way that we operate, even though humans looks kind of similar. We have arms and legs, but we are very, very different from each other. Obviously, I always tell patients, the MS patients are like flowers. You recognize one, but they are all different. So the
Mhm.
same with the immune system, right? So what we think and what we have learned is that the function of the immune system actually have a small variations, just tiny variations. And those variations are associated with proteins and genes that we know are altered, but just a little bit, not a lot, you know. And then we actually know that by studies done in the last 5 years, there are about 240 different variations between people, and those variations will make you at risk. You're not gonna have MS if you have those variations, but you're gonna have more risk if you have them. So we know for data that is actually just came out in the last 2 months that if you had an abnormal immune system because of maybe a little bit of genetics alteration, plus a bad environment, vitamin D deficiency, the
Mhm.
exposure to Epstein-Barr virus when you were a kid, these two things collide and make you at risk of beginning of MS. So
Mhm.
that's the beginning of the process, and then over time, this autoimmune attack is generated in the periphery, meaning in your blood, and then goes to the brain. There are
Mhm.
areas of the brain that are more susceptible. There are veins around certain areas of the brain where you start seeing lesions. So, as I mentioned to you, these lesions or these abnormalities attacks, certainly, the brain, the myelin, and other cells, but they are completely different from each other. So that's why many patients, when we see them in clinic, they go like, "Oh, Dr. Imitola, am I going to go into the wheelchair? Oh, Dr. Imitola, what's going to happen to me?" And I say, listen, I know that you went to talk to Dr. Google, and Dr. Google told you some things, but
Right.
Dr. Google doesn't know you. I
That's
know
right.
you a little bit more. So let's talk about you. Let's examine you. Let's get your information. Let's get your pictures, your MRIs, to understand what your immune system is doing. So there is a lot of variation among patients. So the most important thing that you have to do is actually try to have a doctor that can explain things in a manner that you can understand and actually go deep into what's going on. So at the end of the day, yes, there is an alteration in the immune system that is actually worsened by the environment. We know, for instance, that people with MS have the exposure to EBV, the Epstein-Barr virus, and it appears
Mhm.
that this is a trigger for multiple
Right.
sclerosis. So, and the vitamin D, and there are other things like
Mhm.
smoking, that
Right.
obesity in our
Obesity. Mhm.
populations. So this is important. So what is that data helping us or telling us? Well, if you have any of those risk factors, you by reducing a little bit those risk factors, you can actually improve your chances to
Mhm.
going to the full blown disease.
Yeah. I mean, so, the other fascinating thing, and one of the reasons that I wanted to become an MS specialist is that there's so much that we still have to understand and so much that we still need to know. For instance, with some autoimmune diseases, other common autoimmune diseases, like let's say lupus or rheumatoid arthritis, there are antibodies or even NMOSD, which is a disease that's similar to MS, but affects mostly the eye and the spinal cord. There are antibodies that we can check, right? That kind of give us an inkling of, this person likely has this condition. And we don't have that for MS,
Yeah,
and even when we think about the types of medications we use, we thought that a certain type of white blood cells, the T cells, were it, and everything was about the T cells. And then all of a sudden we find out, oh, we need to be looking at B cells too. And now we're looking at all different kinds of cells. So there's
yeah,
still a lot to discover and explore. There's a lot more we understand than we did even 10 years ago. But there's still a lot more that we need to understand about that immune system interaction with
yeah,
the environment and with all of those other risk factors that you discussed, like smoking, obesity, etc. So let's talk a little bit about, in a broad sense. So when we talk about MS, we say, okay, MS is an abnormal activity of the immune system. The immune system is doing something it shouldn't do. So when we talk about treating MS in a broad sense, we want to try to stop the immune system from doing that. And we have a variety of different ways that we try to target that. We have some medications that are what we call immunomodulators. I say that they kind of tweak the immune system a little bit, but don't necessarily suppress or kill things. And then we have some medications on the other end of the spectrum that actually deplete or kill cells in an effort to decrease that immune response. Can you talk a little bit about kind of what this means, like in terms of, suppression, et cetera, because that's a big concern for many of our patients, especially in light of the COVID-19 pandemic, where people were very concerned about infections and very concerned that their immune systems were suppressed or
Mhm.
not working because of their medication.
That's a great question. And the concept of immunosuppression actually is inaccurate for describing our medications for MS, because immunosuppression is the concept that is coming from the transplant field. In
Mhm.
transplant, you have to immunosuppress the patient. And, the immunosuppressions medications that we use in transplant for the last 30 years are very, very, very effective, but they are very intense. And they
Mhm.
only will, if you remember the army that we explained, they will take every single aspect of the army, the B cells, the T cells, etc. However, over the last 30 years, uh, because we understand the immune system better and we understand MS, people have, tried to look for the smart ways to kind of modulate the system, right? So we historically, many of the patients in the audience will remember that about 20 years ago, we had medications that were injectable, or medication that, were the beginning. So medications that modulate the immune system in a different way. And then about 10 years ago, we started having better medications that are more specific, and most of them are oral medications. And now, finally, we have these medications that are mostly infused medications, because there are actually antibodies. Antibodies are just proteins that they blockade something that is abnormal, and then we have two. I mean, one that actually is a blocker for migration of T cells
Mhm.
in the brain, and then we have another one that goes to actually deplete or decrease or eradicate some of these cells, and in this case will be the B cells. And then finally, we have other tools that we're using that are what we call higher potency medication, that are very, 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 very depleter of several kinds of cells, and we think that they have a role to play. You need to have infusions at least every year. So we have a lot of medications in MS, and the important thing is that not all the patients will have to take all the medications, or start with any particular medications. What we do is that, collectively, our researchers and investigators have suggested that perhaps the best way to treat MS is actually using the correct medication for the correct patients. We know
Mhm.
that our Hispanic, African Americans patients will have a lot of inflammation. So we need to actually match that disease with a better medication. So that's why it's important that patients have the support and the advocacy and the help or the guidance by MS doctors that knows what's going on with those multiple medications. But we need to choose the best medication. And usually, the best medication will be a medication with high potency at the beginning of the disease. Why is
Mhm.
that? Well, because I'm telling you the honest truth. I haven't seen a patient that says to me, "Hey, Dr. Mitola, you know what? I want the worst medication for my case." You know,
Right.
after I explain, why am I worried about you? What is important? What are the goals of care, etc. They say, well, give me the best medication because I don't want to have additional damage or additional lesions. And that empowerment, when you talk to your patients and you say, this is what it is, this is what we have out there available to you, and the patients always choose the right thing for them. So yeah,
Yeah.
in general, we have a ginormous amount of medications that are more common, but I think that the most important thing is to start early, to start with high potency medications in the beginning. And one thing that we have to emphasize is that patients needs to get treated and at least diagnosed early. There is
Mhm.
a lot of patients that sometimes they don't have the opportunity because they go to the chiropractor first, then they go to the general neurology first. If you have the chance and the time, go to the MS Society. The MS Society has a lot of information that is relevant. Call the patient navigator, talk to Misty, or find somebody in your area that it has expertise, because we need to get your diagnosed and treated immediately.
Absolutely, absolutely. And there's so many good things that you said in that. And I think the one piece that I'd like to bring out is when you said that our medications, when we talk about suppression, it's not the correct word for our medications. And so when I explain it to patients, I draw them this horrible picture. I tell them, I'm about to draw you the worst picture you've ever seen in your life. And it really is, because I'm no artist. But I try to explain the B cells and the T cells and how these medications affect the different cells, but I always add the caveat that the medications that we use, we're not suppressing your immune system to the same extent as if you were getting chemotherapy, like for cancer. When I used to, train as an intern and we had patients who were on the cancer ward, they had to stay there for a while because we knocked their immune system out and they couldn't go out, and everybody had to wear gloves and masks when they saw them pre-COVID. So again, we are depleting or getting rid of some of those cells, but we're not knocking down your immune system to the point where you can't go outside, because pre-COVID, we weren't sending people out with masks on and gloves after they got their treatments. We were just telling them to wash their hands a lot. So in this kind of thought about high potency therapy, right? This conversation about stem cell transplant has been ongoing for many years. So one of the things that I always tell my patients is that stem cell transplant is not new, right? The research has been going on for years. But, there are lots of things that we still haven't figured out. Like there's not one protocol that everybody uses. And then there's this question of where to use that type of treatment, because we want to start aggressive treatment early. But in some cases, people in the past at least have died or passed away, from some aggressive treatments. And we know that MS is not a fatal disease. So how do we balance that? Well, first, let's take a step back and talk about what is stem cell transplant in the
Yeah,
context of the studies and research we talk about MS, and then
yeah,
kind of where could we potentially put that in how we treat people with MS?
yeah. So if we go back to your first question, MS is a real immune driven disease, right? So
Hmm.
one of the things that we have learned, and now we are more convinced of that everything is start because we have a dysfunction of the immune system. Imagine that I have a magic wand and said, I'm going to take out all the cells that are unruly, all the weird cells that you have. That will
Hmm.
be the cure for MS, right?
Right.
That's a simple explanation. But we cannot just do that, because there are no ways to do that in this setting. So what has happened in the past 20 years, 50 for the bone marrow transplantation, but about 10 years or 20 years in the field of MS, is that people have started to investigate whether or not these hematopoietic stem cells. Remember, we have stem cells in many places in the body, but the cells that produces your T cells, your B cells, your macrophages, all of those cells are generated in the bone marrow. So every
Hmm.
time you touch your bones, inside the bones, there is a special place where every single day there are these very primitive cells that you have, and they start producing the rest of the cells, the immune cells, right? So the rationale is very simple. The rationale is saying, well, if you have the army and the navy, and these guys are unruly, why don't we just get rid of them, and we gave you a new immune system? Imagine that
Hmm.
you can do that, right? So how do we do it? Well, first you have to kind of kill everything that is there,
Right.
right? Number one. And then you have to replace that with new cells. And these cells are the cells from your own body that are coming from the bone marrow. So these cells are called hematopoietic stem cells. You have it every single day because we produce cells that we need. Actually, if you, for whatever reason, and you remember maybe these movies that you saw when we were a kid, that somebody got irradiated, and
Hmm.
they got irradiated. Well, all the stem cells die, and the person gets more infections, and the person actually die because they have a lethal irradiation of the bone marrow. Well, because the cells are there. So
Hmm.
in the case of therapy, we're not going to lethally irradiate you, but the idea is to eradicate with a mild medication the cells that are unruly, and then take the bone marrow cells, cryopreserve, meaning you put it outside, you select the most primitive cells that are called hematopoietic stem cells, and you put them back on the patient. So these cells will regenerate your immune system. So you get, quote unquote, the immune system of a newborn. It's not
Hmm.
accurate. You get my drift, that you get a brand new immune system. So in the past, we didn't actually realize how important this was for the actual MS. And then people have done a lot of studies that says, well, one thing that happens is that in fact, all the cells that were malignant or were participating in the damage, they're gone because you irradiate them, right? And then these new cells, they have no clue how to make a mess, and it takes years for them to figure this out. So what
Hmm.
happens if you have a cell that is confused and said, I don't know how to make a MS plaque? So what happens? Well, what happens is that you won't have an attack. What happens is that you're not going to be having progression. So there is a lot of great studies over the last 5 to 10 years that have suggested that the hematopoietic stem cell transplantation can be a option for MS. The problem is that it's front loaded. It's not like taking a couple aspirin and then go
Right.
back to work. This is a front-loaded process, and the more we try to teach the patients, the advocates, the people that are going to fund and pay for the procedure, the better is what we can achieve. I mean, we have now a lot of good information, and by the way, that information has compel us to do studies by which we're going to compare the bone marrow or the hematopoietic stem cells with your typical medication for MS. Imagine
Hmm.
that. So we are comparing now your typical depleter with your hematopoietic stem cells. We have a certain level of confidence that these studies that are ongoing in the United States will come with positive results. Why? Based on what? Based on the fact that we have actually in the last, from 2015, 16, and 17, we have studies that support the efficacy of hematopoietic stem cells. What is the problem? Well, the problem is that remember that I told you about killing all the cells, and this is
Hmm.
this is called a myeloablative regimen. So basically, there are many ways to achieve that. I mean, there are ways that are very intense. There are others that are less intense, and this actually can lead to morbidity and mortality. In the 1990s, the mortality of this procedure was high, and now the mortality is about 0.3%. And you
Hmm.
can say, well, 0.3% is not zero. You're right. And then the idea is to keep going and reducing that mortality to
Even
zero.
lower.
Yes,
Hmm.
put it in zero, right? So how do I see what is important right now is that the patients are informed. By the way, the National MS Society had a position paper last year. We work in the guidelines that are public in the website, and we recommend that patients that are failing this type of medications, right, the medication that we use every single day, patients that are young and patients that have disease less than 10 years might be considered a candidate. What is the problem right now? The problem is that guidelines are okay, but the problem is the implementation. The problem is
Right.
that there's no connection between I, as an MS doctor, I cannot transplant people because
Hmm.
I don't have. That's not in my wheelhouse. I have to collaborate with a bone marrow transplant expert. The more that we neurologists talk to the bone marrow transplant is better. And actually, by the way, the more that the patients, because the patients are the ones that need to be informed, so they can actually put pressure to the government and the insurance company to make this happen. Otherwise, it's actually just a recommendation without any follow through.
Hmm. Yeah, so many good things that you said, and so I think one of the things that I try to bring attention to is certainly it's important where you get this done, right? And all stem cell is not created equally, right? There are a lot of clinics that are doing procedures that are called stem cells. Stem cells is a hot topic, not just for MS, for arthritis, for everything. Everybody wants stem cells to replace something or renew something. And so, one of the things that's very important to educate, which I'm glad you did go into detail about the process, right? This is not a simple process, right? So you don't just go take 2 pills and wake up in the morning and you've had a stem cell transplant. There are some places that are doing other procedures that are called stem cell transplants, where let's say they may take some fat cells from your tummy, like a plastic surgeon might do liposuction, and then they radiate those cells and give them back. That is not what we're talking about. We're
Yeah,
talking about traditional hematopoietic stem cell, which is the same type of procedure that they do for cancer,
right.
and so I think it's important for people to understand that, not to say that we shouldn't use it, but to recognize that just because something has stem cell written on it does not mean that it's the same procedure that the research has really proven will help MS.
Yeah, I'm glad that they bring this up because, we have worked in this over the last 2 years, 3 years, and in the United States there are about 650 quote unquote stem cell clinics that in reality they are not offering any kind of stem cell. So a stem cell is research, and the only stem cells that are indicated clinically for malignancies and MS is the hematopoietic stem cells. So if you go to a website that says and that showed that you have all these great patient testimonials, and they say that they cure anything from Alzheimer's, cancer, lupus, beware, because that's not what we are discussing. And in the United States as well as in other countries, there is a lot of that. I mean, and by the way, we have seen in by work that we have done that many patients, they go and do GoFundMe campaign. They go to Mexico. They don't know what they are injected with. I have a patient, a African American 35-year-old gentleman that paid $20,000 going to a place in San Diego, and he doesn't know what happened to him. Somebody injected something in the back, but there's no information. So you have to be extremely careful about
Mhm.
that specific area. I mean, I work in stem cell research, and I can tell you that what we're trying to do is difficult. I'm not saying to you that we will never use or develop stem cells for other indications or other types of stem cells, but it is important to say that at the moment, because many patients are desperate, and I talk to patients a lot about this, and they bring me a very glossy brochure saying, "Oh,
Mhm.
these guys will give me." I had to pay $10,000, and they asked me to get a clearance from you. And I said, well, that's not the way it's supposed to work, right?
Mhm.
So you had to ask them, where you publish your data. Do you have any published data?
Mhm.
What kind of stem cell am I going to get? Uh, this kind of questions are relevant. The only thing that I can tell you, even for hematopoietic stem cells, because let me tell you one thing, bone marrow transplant is done in 100 countries around the world. Okay.
Mhm.
But since we have this discussion of what regimen is better, many places in Russia and Mexico are taking advantage of our lack of compromise or our lack of leadership as a neurologist. And what is happening is that they say, well, come here. About 50% of patients that go to a couple of clinics in Mexico are Americans.
Mhm.
Sometimes they had to mortgage their house or borrow money to go there, and it's unclear what are they doing to their patients. So we don't
Mhm.
know. I mean, it's not that we are not in favor of hematopoietic stem cell transplantation, but I think it's important to be responsible and tell patients to be aware of these things. When patients have questions, I mean, it's very easy to find us. I mean, they can find you, they can find
Mhm.
the society, and ask what do we think about a particular option, because
Mhm.
that's key to be informed.
Yeah. And so then how do people find out about where this research is being done?
Yeah. So right now, in the United States, we have a big trial happening in 19 centers in the United States. The trial is called Beat MS. Is the most ambitious, comprehensive, and I think that it will yield clarity toward if the stem cell is as good as your typical DMT. Why is this important for the audience? Let me give you a couple of examples. You and we pay about $60,000 per year in medication. So the hematopoietic stem cell transplant is about $150,000. But the amount of years that you're going to be in remission are bigger than the constant paying $60,000. And
Mhm.
in many cases, I mean, we have data from other studies that patients at 5 years, 85% of patients will be in remission. So
Mhm.
in the economic sense, it makes sense because you
Right.
don't have to pay, you don't have to be with the $60,000 every year. So that's an important thing. So that's what we are doing the research. Now, beyond the clinical trials, as I mentioned before, the MS Society has recommended that certain patients may be a good idea to contemplate this. And I think that it's important to say that patients that have a lot of disease, that are breaking through medications, that are young, may be candidates. And the problem that we have, and this is why we need the public, is that the insurance company are not paying for the
Right.
procedure at this moment, and the government, the Center for Medicaid Services, are not paying for this. But the more our advocates are in the know and they have more evidence and more information, that will change. So we are in a inflection point. I think that the trial that is ongoing here in the United States will have a preliminary finding probably in 3 to 4 years from now, and that will probably tilt this toward licensing and approval. Now, we have to say also that not everybody will be a good candidate for this.
Right.
So if you are older, if you have comorbidities, etc., the mortality of that procedure will increase. So, I
Right.
mean, obviously, at this moment, the recommendations are for certain individuals, but that's why it is important to educate and inform our patients that if we start early in the process, we don't have to pay the amount of sacrifice that we do at the end. So that's why
Yeah.
we endorse treating early, finding out early if your neurologist or your PCP is not helping you. You need an MRI to see whether you have lesions in the brain.
Yeah, absolutely. So much wisdom there, and we have one question in the chat. Please feel free to put some questions in the chat if you guys have any questions. I see one that says, "What does a good stem cell replacement candidate look like?" And you kind of touched on that, but can you kind of reiterate what
Yeah.
potentially a good candidate would
So
look
this is a
like?
great question because I mean, in medicine, we either do these very stringent clinical trials that are
Mhm.
very regimented, or we do something called real world. And real world is when we already are more confident about things. So if you take a look at what the MS Society has said, is people that are less than 50 years, people that have less than 10 years of disease, but people that have failed medication. So this is a optimal candidate, right? To explore that. The problem at the moment is that if you're not having a part, if you're not part of the clinical trial, then somebody has to pay for it. And
Hmm.
unfortunately, it's going to be either the person or the in the future the insurance company or the government. And in other countries like Sweden, this has become actually part of the standard of care,
Mm.
right? If you have a MS and your MS is ugly and from the beginning, because we have to say this, right? Not everybody will need a transplant. That's an
Mhm.
important thing. So if you barely made the criteria for MS and your MS is being stable because you're very, very good and not smoking and doing the things that you need to do and take your medication, perhaps that is a person that may not need that, right? But if we, at the end of the day, in a couple of years from now, we understand that bone marrow is equal to any kind of other medication for MS, it's very hard to not include that in the armamentarium. And also, it's especially if that mortality goes way way down
Right.
to zero point 0.3 or less than zero point 0.3. Now, where do you get this? Well, at this moment, as I said, part of the clinical trials, or also there are now other clinical trials that are done in those institutions that are doing the big trial, and they can include you in the roster. Now, one thing that the MS Society has done is to recommend patients to check whether the institution that they are looking for, or whether locally they have an institution that can do the transplant, and
Mhm.
direct approach the institution, because and then ask the neurologist to refer. So we have
Yeah.
a responsibility, and if we refer patients to the bone marrow team, it's going to happen. Otherwise, it's not going to happen.
Yeah. So that empowerment and that education is so important, and we covered a lot of ground, and we could probably talk about this for another hour. But we covered a lot of ground. And I think, the important takeaways that at least I'm hearing are, number one, understanding, that, stem cell is a process, hematopoietic stem cell transplant is a process that we have been learning about for years. Definitely shows a lot of promise with MS, and there's a large trial going on to really help us to figure out kind of where to put this and how it compares or matches up to the current therapies that we have. If you are interested in a procedure like this, it's important to make sure that there is a reputable institution where we know and have some record of what's happening to you, so that can be reported, and make sure that, you talk to your local neurologist. You can go to resources like the MS Society to learn about what institutions in your area may be doing stem cell transplant, and ask your doctor to refer you there, and they could at least do a consult to see if you may qualify for this type of procedure. So there's a lot of work that's been done, but we still have a little bit of a ways to go. And it really, at the end of the day, is about that partnership with you and your healthcare team, and kind of going back and making sure that you guys are coming up with the right plan for you. And I see we have one more question in the chat. What is the success rate for stem cell transplant for patients with MS?
Yeah, so that's a great question, and there are probably about 10 to 15 years worth of data. So there is no doubt that stem cell transplantation is effective. And how do we measure that? Well, people do the transplant, they follow the patients over time. So what do we have in terms of what is the metrics, right? So we have a metric that is called NIDA, and it's an acronym, but it's basically no evidence of disease activity. So what does that mean? You go to the doctor and they say, "Oh, your MRI is stable. You don't have any relapses, and there is no new lesions in your brain." So, and you walk the same as you walked before. So every
Mhm.
time you go to your doctor, we do these things, and we measure things in you. So the success rate of the transplant varies, but it's about more than 60 to 70% to 5 years. Now, this also depends of what regimen is used to induce the total disappearing on the cells in the body, the cells that are unruly, right? So there are three regimens. One that is intermediate, the other is very intense. The chemo is maybe mild, very in the middle, or very intense. Now we know that intense regimens are going to have more complications. So people have done the intermediate. It's a long-term efficacy, but not a lot of complications that you can expect. So what we're trying to do in the United States is use this intermediate regimen. That's the part of the BDMS trial that is done and led by the Cleveland Clinic and multiple other areas in other centers. But the idea is that this intermediate regimen will be is a compromise, right, between effectiveness and side effects. So the idea is that yes, it's effective. The problem of the stem cell is not whether it's useful from the point of view of effectiveness. The problem is how to implement it and how to monitor it in MS, how to maintain the safety profile. Because
Right.
if you are in institution A that has a lot of experience, and you go to institution B that may not have the same experience, those numbers are going to be actually different. It's like having a transplant of other kind. You go like, okay, so I need a liver. Where do I go? So you're going to pick up the place with less problems or less issues, and that's why there is another issue that we need, and that's what the public needs to be informed. We need registries, meaning that when you do a transplant, it's a public information.
Right.
So it's like a Dr. Imitola did a transplant of the liver in the last year, and look, 100% success rate. Or hey, you want to go to Dr. Imitola? No. Dr. Williams did transplant of the heart, and every patient, was perfect. And so you want to go to Dr. Williams. So that's an important thing, and that's why our patients needs to be informed how to navigate this very complicated healthcare system that we have. But empowering the patients is going to be key to implementing these kind of therapies.
Absolutely. Absolutely. So excellent questions, everybody, and an excellent discussion. Thank you so much for bringing your expertise, Dr. Imitola, to Brain Chat. For those of you who enjoyed the discussion, please like it, and please let your friends know about it. And also, please subscribe to our podcast, which is Brain Chat with the Nerdy Neurologist. It is on Apple Podcasts, Spotify, where all podcast platforms are housed.
So
You said what?
I like the music.
You like the music? The music is at the beginning of every show, so you can listen to it over and over and over again as much as you like. But yeah, so we're really excited. About this topic. I think it's one that's extremely important. Our patients are asking about it all the time, and we need people to be informed to make good decisions about their care. And so thank you so much again, Dr. Imitola, for your time. Thank you for all of you logging in. It is MS Awareness Week, and we are representing here for the MS Society and for all of you amazing MS warriors that we get to serve every day. Thank you so much, and everyone have a wonderful evening.
Thank you for having me.